Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Randi Jaffe speaking on spinning babies. Dr. Randi Jaffe has been practicing chiropractic for over 23 years. After treating her first pregnant patient early in her career, she discovered her passion for helping women feel more supported both physically and emotionally during their pregnancies, labors, and the postpartum period. She received her Doctor of Chiropractic degree from the National University of Health Sciences in Lombard, Illinois in 1997. In addition, she has a BA in biology from SUNY Oswego and a BS in human anatomy, also from National. She has taken numerous hours in continuing education in the areas of pre and postnatal care, as well as pediatrics, always looking to add to her knowledge and increase her hands-on skills. Dr. Jaffe treats patients of all ages, from infants to seniors, with a special interest in the treatment of children and pregnant and postpartum moms. She is caring and compassionate with each of her patients and emphasizes the mental, emotional, and spiritual components of her patients' healthcare in addition to the physical aspect. Dr. Jaffe lives on Long Island with her husband, Michael, and her 2 teenage daughters. Hi, Randi. Welcome to the show. I'm so excited to have you on today.
Hi, Laura. Thank you for having me.
Yeah, this is fun. So Dr. Jaffe and I go back years. We've known each other a very long time, both being fellow chiropractors and women in the New York City area and having such a passion for serving the perinatal women in our community. So this is such a treat for me to be able to connect with you today on the podcast and talk about some of our favorite topics.
Yes, definitely. We love pregnancy.
Love pregnancy and everything that goes into that, of a woman preparing her body for pregnancy, having a pregnancy that's vital and healthy and happy, and then entering into that empowered birth experience. And there's so much prep work that women can do to really help support them in all aspects of their pregnancy, physically, mentally, emotionally, and spiritually. So today we're going to really focus on the physical component regarding spinning babies and how this technique can be so helpful for women during their pregnancy in helping them feel good during their pregnancy and then helping them have a good birth experience. So let's start off with talking about what is spinning babies.
Spinning Babies was founded by a midwife in Minnesota, amazing midwife. Her name is Gail Tully, and she came up with different exercises and positioning and some lifestyle changes that can help not only with we think of spinning babies as like, oh, I need to get my baby to turn. So let me go on this website and scour, through all of this and start doing these techniques. So these techniques can be used, which you touched on, to prep yourself for labor, to help with pain and aches and discomfort during pregnancy, and then also to help with optimal fetal positioning. So it all kind of ties together, and I am just in awe of the work that she's put together, and I recommend it all the time. It is really, really fantastic. And again, the name lends itself to think, oh, I need my baby to turn in a different position. Let me dive down this rabbit hole, right, of their website and their information. But it really, really, I can't stress enough, can be utilized all throughout pregnancy with the end goal, of course, being that healthy and optimal birth.
Right. So is this even something that a woman in her first trimester can do?
Absolutely. Yes. They talk a little bit on the website, which is very comprehensive, about different exercises that you can start doing and at what phases. And there's something that I love called the Daily Essentials. It's a video download, and it's just really wonderful for just keeping everything nice and open, aligned, prevent muscles from getting tight, relaxing the ligaments that attach into the uterus and the pelvis that help hold the baby. And it's great to start early, but I do want to stress that if someone doesn't start early, that it's never too late to start all this work.
That's good to know. So this is something you can do at the very beginning and then progress to different, depending on what stage in the pregnancy you're in. Or a lot of times I think women do find this possibly in their third trimester, and that's okay too. It's like, what you know, and you bring it in. And I think there is definitely a misconception that this is only relevant for third trimester, breech, transverse position babies. And it does help with that, right? But
Absolutely.
it's not specific. It's good for any pregnant woman.
Yes, and there's so much that goes on these days with, women sitting a lot with work and just different exercise that they do and all the wear and tear of life, sitting in a car, taking care of other children, all the stuff that we do throughout our daily life that can put strain on the pelvis, the lower back, as you and I know very much so as chiropractors, but this absolutely can impact how a woman feels during pregnancy, positioning of the baby as we approach the third, trimester and the due date, and then of course the birth. So all these lifestyle things, really, really, this work helps that a lot. As well as our work as chiropractors and other therapies that can be utilized within the pregnancy. So I really feel strongly that it is great to start early, but it's also fine to start there are women that start this at 35 weeks who have a head down baby, and it's great. Whatever you get in, you get in. And as you said, whenever you find it, and the benefits are still there.
Right. And so it sounds like the website is also educating women about lifestyle. So in other words, having a better awareness of how you're holding your toddler, for example, in a second, third pregnancy and your movements, all of her activities of daily living, how a woman can maybe optimize those movements to help minimize strain on her pelvis and spinal alignment.
Yes, absolutely. So a couple of examples are they talk a lot about sitting on a physio ball or an exercise ball while you're eating or while you're working at your computer. And it just creates a bit of movement. So instead of being so sedentary, we have a little bit of give with the ball. The other thing that they teach that is on the daily essentials is how to get in and out of a car. So like what a simple thing that we don't even think about, but how to, bring your knees into the car and your hips. They talk about sitting on like a little bit of a cushion in the car, so these little tips are just, and there's lots of them on there. But they're so helpful because we're doing these activities repetitively and they can create all sorts of dysfunction in our bodies throughout the pregnancies.
Yeah, I think this is so important. That's one thing that's really come to my awareness about how, even to a deeper level, ADLs, if, I guess, because I have awareness of my alignment, right? As a chiropractor, I have pretty good body awareness. So I'm aware of how I move my body during the day and what things are not good for my body to be doing. But that not necessarily everybody has that understanding, background, or education. And so the more we can really be conscious of these things that we do, certainly subconsciously, right, for the most part, but that can be very detrimental. Even having a standing desk, with ergonomics, that's so important as more and more people, certainly right now, are working from home and they can have sometimes really, really crappy work ergonomic situations at their house.
Yep.
So if you're pregnant, this is non-negotiable. You need to have this really ergonomic workstation. And I love those physio balls because those are just great for even opening the pelvis and really gentle on, the joints and the ligaments and just helping to kind of open and shift things around.
Yes. So just adding something like the ball at any point in the pregnancy, especially as we move into that third try, it's great for the whole time, but really, really helps to prep for labor and it works some of the muscles and it's just, wonderful. So these are like little things that women can incorporate into their lifestyle, not sitting back on the couch. We always talk as chiropractors about women leaning back. So they're leaning back on their sacrum and their tailbone and there's a lot of compression and kind of, I always think of an accordion, like just squishing together and a lot of pressure there that we really want to sit on our sits bone. So, we as chiropractors really get into that with our patients, but spinning babies is wonderful in that, it just goes hand in hand so well with our work and that they're also talking about that and giving these lifestyle tips that really can impact a woman's pregnancy and baby's position and labor. I'll keep coming back to those three things because they're it's all encompassing. Our goal is always that due date. Someone comes to us right in week 12 or week 6 or week 20, and we're always thinking about what is that labor going to look like based on what we're seeing in their bodies, right? So it's always the end goal, but we want their experience to be wonderful all throughout.
Right. And I think that's important for women to recognize that even if your baby is head down at the end of your pregnancy, it doesn't necessarily mean that your pelvis is lined up or the baby is in an optimal position, right? Because even head down can have slight variation, right?
Absolutely.
If we want to think about birth being, I like to think, give the analogy that the pelvis is, as the birth canal is like a basketball hoop, and then the baby is the basketball that is transitioning through the pelvis. If both parts aren't lined up properly, it's going to be much more challenging to deliver that baby vaginally. And that's where sometimes we'll see women get stuck during the labor process and end up with an emergency C-section that could have been avoided if things were lined up and the tension in that pelvis was removed and the baby was in that optimal position.
Yes, absolutely. I love that analogy. I haven't heard that before about the basketball. So it's always great to get the visual. That's wonderful. But yeah, we always hear about, maybe an arm was up over by the face or a hand by the face, I should say, or an arm up over the head, or maybe the head was just slightly tilted and it's just jamming into a bone that if that bone had been a little bit more, those joints had been a little bit more open, could have prevented interventions, including a C-section. So yeah, it really is important to make sure that the pelvis is nice and aligned. And a lot of that is our work. And then the spinning babies ties in so nicely because they're working a lot on soft tissues. So they're working a lot on the muscles, relaxing tight muscles. As you and I both know, the muscles get very tight in pregnancy because the ligaments are getting loose, right? So most of the ligaments are getting loose because of all that relaxin hormone surging through the body. So ligaments are loose to kind of open that basketball net up, right? And then the muscles get tight. So spinning babies works a lot with the muscles, a lot with the ligaments, and then also the ligaments that attach into the uterus, which really get sort of, I heard this analogy from a yoga instructor, and she talked about the uterus being like a hot air balloon, which you've probably heard that as well, being tethered to the ground. And I kind of added to it some wind, meaning the baby is kind of the wind, right? And our movements are the wind. So this, uterus is kind of, or hot air balloon, is back and forth. And these big tethers, which are the round ligaments, are being kind of pulled and sometimes really stretched and tight. Sometimes one side's a little looser. So our work, spinning babies work, really works to get these ligaments that hold the uterus in place relaxed and not as tense if there is tension on them. So it's really all about balancing. I think that's the word. When I hear spinning babies from some of the coursework I've done with them, that's the word that comes up the most for me is balance. They're balancing the body to create a better environment for baby. And then that leads to that better position and leads to that better birth outcome.
Right. Okay. And that makes so much sense to me too. Because you and I are both Webster certified chiropractors. And that's what a big part of the technique is, where we're balancing the pelvis, especially the tailbone, because we know the uterus attaches to the front of the tailbone. And when it's out of alignment, it will create this intrauterine constraint that can cause a breech or transverse position baby in the third trimester. So what we learn is, we actually release those tight ligaments, the round ligaments, typically on one side, to help balance out the actual bony pelvis.
Yes. And I just want to go back and clarify one thing, because this gets so confusing for people. We talked about the muscles being tight. We talked about the ligaments being mostly loose in the body, but the ligaments that attach into the uterus are a little bit different. They actually can get tighter, right? So they're just to differentiate those two issues with the ligaments. So again, tight muscles in the pelvis, the glutes, the hamstrings, the hip flexors, the IT bands on the sides, so much tightness and tension. And then again, all those ligaments in our body that are holding joints together are getting really loosey-goosey, I always say in my office. And then we get those tighter ligaments that attach into the uterus because there's so much growth and so much change, right? Every day, it's like you're in a new body, and you look at yourself a week later and you're like, oh my gosh, what happened? It's changing so rapidly. So again, the round ligaments and some of the other uterine ligaments are that exception where they do actually have some muscle in them. So they do get this tension to them. So again, spinning babies and our work as well with the Webster technique help to ease that tension on the uterus.
Mm-hmm. So if a mom finds out that her baby is breech, what do you recommend that she does?
That is a great question. And, it's so stressful when you find out your baby's breech, especially for women that, it just wasn't on their radar, right? They just weren't even thinking about it. All of a sudden they get this information and, depending on when they get it, I think it's always stressful, right? Especially with a woman that has a birth plan to have a vaginal birth. So I often recommend just diving right into all of this work. So I really love, of course, we're slightly biased, you and I, Laura, really love the Webster technique, super gentle and safe and very effective in helping make more space for the baby. So, we know this, but just to share that we are not manually turning this baby, but we are working to align the pelvis, including the front of the pelvis, that pubic bone in the front, the sacrum in the back, the sacroiliac joints, relax those muscles and work on those ligaments. So creating more space. So the Webster technique, of course, I recommend starting right away. Usually that can be, if it's for a breech, if someone's, getting that information, I would say, I don't know if you have some thoughts on this too, but somewhere between 28 and 30 weeks, if you find out at that time, that would be a time to, I would say, start as soon as you can, right? At any point.
Yeah, the beginning of the third trimester. I mean,
prior to that, we're not really worried about it too much.
We're not worried. I mean, I usually say 30, 32 weeks. That's around the same timeline. But unfortunately, at least in my area, I find a lot of women don't have the baby's position checked until the 36-week ultrasound. And that's when we find out for the first time. And that's stressful because now we're approaching a due date.
There's scrambling.
A C-section scheduled at 39 weeks, literally 3 weeks later. And there's a lot of scramble. And that's putting a woman in a very overly sympathetic nervous system state as well, which does not help the position of her baby. So, it's something that I do let women know, like you can certainly, ideally your birth provider, some of them do ultrasounds at frequent visits, but even if they're not, they can manually feel for that baby's head. Mm-hmm. And it'd be good to know, certainly towards the beginning of your third trimester as opposed towards the end.
Yes. And I often recommend that women, especially if sometimes they have a lower tech sonogram machine or ultrasound machine in the office where they'll send women out to a hospital or another facility for those higher tech, the anatomy scan and other high tech sonos. But I'll often say, why don't you just ask your practice if it's okay, or at an earlier visit, if they're not doing them more frequently, to just take a quick look, just a quick look. Where's the head? It's literally a few minutes. And they often are so appreciative that, we suggest that because it just gives them that information so much sooner, and it does decrease the stress. Baby's smaller, fluid levels are higher. It's so much better to start early, as you and I both know, but most people don't know.
Yeah, and there's a higher efficacy rate as well regarding the Webster technique. If we can see a woman earlier. And I think, let's say a woman does find out around 30, 32 weeks that she's breached. Sometimes the recommendation from the OB is, the baby could still turn, so don't worry about it, right? And I have a different mentality. I'm like, your third trimester now, yes, could the baby turn if you do absolutely nothing? Yes, that could happen. But let's be preventive minded. Let's start doing chiropractic adjustments and getting your pelvis balanced. Let's do some spinning baby exercises. And see what happens. And then certainly another, thing that can be helpful is the moxibustion, acupuncture.
So those are actually the three things in answer to your question before. We're on the same page, of course, because we practice very similarly. But those three things I feel like together, or each of them work on their own. As you said, doing nothing sometimes works, but it's a little dicey. And I feel like those are the three things. So people go online and start searching, and I say, listen, let's take a breath and let's make a plan. And the plan plan is chiropractic care, including the Webster technique, spinning babies work, and then add in the moxibustion, which is an acupuncture technique that helps increase fetal movement. So all of those are really safe things to do. They're pretty easy things to do. There's some time, of course, involved in all of this. So I do tell women you really have to carve out some time to commit to this. And for women that are really leading, really busy lifestyles, have other children, work is crazy, they have personal things going on, I tell them to do what they can, right? I'm sure you do the same. Just do what you can. Whatever you fit in is better than not, right? And a lot of times even that, doing it at a lower level, or maybe shortening some of these exercises on spinning babies, or, spacing things out a little bit. Again, that is all comes back to finding out sooner, right? If we're finding out later, it's like this crunch time and everyone's in a bit of a panic. Sometimes even us, right? Add some stress to our world, because we're really, our hearts are in it for our patients. We want them to be able to have that opportunity to birth vaginally.
Yeah, I will never forget a woman who came in, like the very beginning of the quarantine, and she had it was her third pregnancy, and she had 2 vaginal deliveries and pretty quick, easy ones, and that was her plan for baby number 3, and then she found out the baby was breech. And it was like, what do you mean? That was definitely not on her radar, because this is a birthing expert, right? This woman's like, I know how to birth. My body's got this, and no problem, right? And then this was like a big wrench in the
threw her for a loop. Yeah,
threw her
sure.
for a loop. So she was coming in. She'd already been coming in for adjustments to help with back pain, but then we had to increase the frequency of her visits. So we went from like once or twice a week to 3 or 4 times a week to help balance her pelvis. I referred her to the acupuncturist in our office. She was doing the spinning baby exercises at home, and the baby turned. And then literally like a week later, it turned back, which is very rare. Usually at the end of a pregnancy, once babies head down, they don't typically move, but she had a lot of space. Clearly things were a little stretched out, and there was too much room.
Right. That's something we run into with a subsequent pregnancy with multiple.
That can happen. So that was happening. And then it was like, so we had like a sigh of relief. And then like within like a few days later, we're like, what? So back to crunch time, all team, all hands on deck.
Yep.
And we got this baby head down again, and she was able to have her third vaginal delivery. But it was stressful for all of us. I mean, we were literally like, what do we need to do? How do we get you in? How do we accommodate your schedule? Because you have 2 other kids. And, we were just doing whatever we had to do to help this woman, because she was really committed to that. And I think, the other thing that I wanted to mention is that a vaginal breech delivery is just pretty much non-existent anymore. And I don't think, maybe even a lot of listeners don't even know that used to happen.
Yeah, it used to just be a thing. A lot of times they didn't even know, right? That the baby was breech.
And a woman would, so the point is that women's bodies are capable of birthing breech babies, transverse babies. It's just certainly non-optimal. But in the 90s, a study came out that was showing all of the risk associated with vaginal breech deliveries. And essentially, it's been not really something that's
available.
Taught.
Yeah,
they don't teach it. There's a lot of concerns with malpractice, so liability.
It's a lost art. A lost art. A skill.
And that puts women at like less options. I think that's also really unfortunate.
Right. It is unfortunate. And that is the fact that they don't have that option if they choose, and it's just nice to have the choice. Some women might say, you know what, it's just not for me. I just don't feel comfortable doing that. Or my OB recommends it, or my OB doesn't really think it's a good idea because of these risk factors. But just to have that option would be nice. So we have to work with what we have in modern day obstetrics. And what we have spinning babies, and we have the Webster technique, and we have moxibustion, and we have all the different things that we can do. And I think that, you and I know this, but the majority of the time, babies do end up finding their way. And it's really this innate sort of instinctual thing that they just go head down when they have the opportunity to do so. Right.
Correct.
So it's pretty amazing.
It's amazing. Like, there's no such thing as a stubborn fetus that's like, I'm just going to be in a breech position for that
Right.
element to piss my mother off. Like,
Right.
there's a reason why that baby is malpositioned. And, what I find is 85% plus of the time it's musculoskeletal, which goes back to exercises and adjustments to help with aligning the pelvis and making space for baby to turn and go head down. And then there's a small percentage that is like a short umbilical cord or, a uterus that is differently shaped. And these can also contribute to that breech position baby that aren't necessarily going to respond to the techniques that we're discussing, but those are rare, probably really less than 15%. And so that's the exciting news is that there's the majority of the time this stuff works. And by the way, we're not even discussing ECV here. Like this is,
Right.
this is not even, something that we're even mentioning. ECV obviously is an option that is done by an obstetrician in the hospital with an epidural, but it has a lot more risk factors and is not quite as safe.
Right. It is definitely something that we want to try to avoid, but I feel sort of grateful that we have it with our patients as an option with their OBs or their midwives, that it is there as kind of, I call it like sort of a bit of a last resort. And one thing I do want to say about the ECV, and this is definitely not scientifically proven, but I'm sure you've had the feedback from your patients as I have from mine, that if we do have a woman that comes in sort of, on that later side, maybe we have a week to work with, sometimes even the day before an ECV, or even just that baby that just is taking a little bit longer and it's just, we run out of time with the work we do and the spinning babies work and they do go for the ECV. I have had women come back in and they say, I know this sounds crazy, but I really think all the work we did and I did at home, the patient, with spinning babies, with the moxibustion, with the Webster, all of it helped prep me for the doctor's work with the external version where they manually turn the baby. So again, no scientific way to prove that, but we are just sort of getting things more balanced, right? That's what we're working on. So if it's more balanced, doesn't it make sense that if the doctor's going in and manually, using the head and the bum, manually turning the baby. And I want to, I think, reiterate what you said, which is that you are monitored the whole time. You are in the hospital. You are, they're being super cautious. So again, this is a technique that we really do want to try to avoid, but it is nice that it's there. And this work that we do in advance of it can sometimes, in my opinion, get things in a more balanced place for the procedure if it has to happen.
Randi, you're speaking my language. Like because I've seen it. Oh, you and I both have seen it over and over again. We have the woman who even maybe perhaps is wanting a home birth, right? So she's like the last thing from a C-section, and she finds out she's got this breech baby, and she's coming in. She's doing her chiropractic adjustments. She's seeing the acupuncturist. She's doing her spinning baby exercises. Committed to the process. This baby has still not turned. She gets the ECV and it's successful. And I find, it would be really cool to do a study to see the success rate of a ECV post, especially post Webster technique, because it's logical that before you try to manually turn a baby, you want the muscles and ligaments as relaxed as possible, and you want the pelvic joints to be lined up. Like it's just basic anatomy physiology that you're going to have better success. And we do see that. And then these women are able to go on and have their vaginal deliveries, and it's life changing. So
yeah, it's really such a relief. They email us, they call us, they come in for some, another few adjustments before, their due date or their birth, and they're just, so relieved. Like, what a relief. So it's a relief at any point when that baby goes into the optimal head down position, right? Because it really just changes the whole birth plan. It really does.
It makes such a big difference. And once again, it doesn't matter. Even if you have a scheduled C-section for your breech baby, a week from now, you can still, get in to see a Webster chiropractor and do your spinning baby exercises and get to, do this work. It's never too late, and I always give women that hope. I say, there's no guarantee, there's no promises here that we're going to be successful, but it's never too late. I'm always happy to have a woman come in. I had to tell this other story. I had a woman, 39 weeks, acupuncturist, come into my office, breech. She was literally scheduled for a C-section the next day. It's the first time I ever met her. I did my chiropractic Webster technique adjustment that I do on all my pregnant mamas, whether they're breech or not, balanced out her pelvis, balanced out her round ligaments, adjusted her upper neck because that impacts the parasympathetic nervous system, get her out of fight or flight. And that baby turned. And she did not have, she had to cancel that C-section and had a vaginal delivery. So these, I mean, not that this happens every day, but this does happen. And I've seen it, in my own office. And so this work is very powerful, and certainly it's worth doing because it is safe, it is effective, and it has a high success rate.
I also think it really helps with recovery. So whether it's a vaginal birth or it ends up being a C-section, whether it's a scheduled C-section or an emergency C-section, or there's interventions that weren't planned, I do really think that, again, getting back to that basic physiology and that balance of all these structures, that if you're recovering from birth, any birth, that of course you're going to be feeling a lot better and healing a lot better if everything is prepped in advance of that with all of this work, right?
Totally. There's definitely a quicker, easier labor, easier delivery, and also recovery from the birth. And then we see a lot of women postpartum, right? Whether it was vaginal or C-section, that can benefit from chiropractic. And really, once again, utilizing the Webster technique, even though they're no longer pregnant, just to get their pelvis back in alignment. Because even certainly a vaginal birth puts a lot of strain on your pelvic alignment, but even a C-section, we're addressing, major abdominal surgery, which impacts your core muscles, your ability to hold your spine upright when you're sitting and standing, and just moving and holding a baby is putting stress and strain on your spine and pelvic alignment. And we can help support those strains through gentle chiropractic adjustments.
Yeah. And on that note, I find that when women start to become more active after that, they get clearance usually at 6 weeks for exercise or increased activity. But what I find is maybe it's 6 weeks, maybe it's 6 months, whenever they start becoming more active, meaning getting back to exercise or just, starting to move a little bit more, getting outside of the house more, especially in those early months, that's when it hits. That's when you see pain, dysfunction, weakness, and then they come see us and they're like, I don't understand. I was feeling okay right after, but it's when they start to become more active that those misalignments, those tight muscles, some pelvic floor issues, they all start to kind of manifest a little bit more. You see it a little bit more, right? I don't know I assume you see that in your practice as well.
I do. And I think that is interesting because women at that point, let's say it is 3 to 6 months later, they're like, oh, my body should be recovered from the pregnancy by now, right? And so it's kind of a surprise. And the reality is it takes a good year for the body to recover and heal after pregnancy. And the sooner you get, your alignment checked, the quicker your body can heal and recover and have proper recovery. I think that's the other thing. If there's misalignments, you're not really able to heal properly, right? Because the muscle, the soft tissue and the nerves are being stressed, and
lots of dysfunction.
Yeah, there's dysfunction. You may not feel it until then you use your body more, and then those dysfunctions are going to become more symptomatic, but the dysfunction has been there the whole time.
Right. It just seems to come out more as the woman kind of gets back to her normal routine. And then we can go on and on about breastfeeding and all, and even bottle feeding, the posture that goes along with that. That's usually what brings people, I think, to our office for postpartum work initially, is more that upper back, neck, shoulders from just, lack of sleep and hunched over the baby, feeding, rocking, changing, bathing, all of that. So I know, I'm sure you have the same in your office where you see lots of women. And then when they come in, we're like, oh yeah, we get to check their pelvis too, because it wasn't even really on their radar unless they're having some pain early on from maybe the labor. I wanted to go back for a second, if it's okay, Laura, just to talk about some of the benefits of the spinning babies and the Webster work and all of it, with regards to how it impacts the labor. So
let's go
just a
there.
few quickie little bullet points is that it's definitely all this work has been shown to decrease pain, which I know every woman is on board with. Let's decrease that pain, whether you're going for a natural birth or you're going for, a natural birth, natural vaginal birth, or you're going for an epidural. You want to decrease pain because even if you're getting an epidural, you're still having labor before the epidural. It's an appropriate time to get that. We've seen, especially with all of this work, again, getting back to spinning babies work during the pregnancy, those everyday essentials, the positions, the Webster technique, regular chiropractic adjustments, the length of the labor is shorter, right? We always hear that from our patients that, oh my God, I can't believe it. My labor was 5 hours. I just had a woman last week who delivered a 10-pound, 6-ounce baby vaginally, and it was basically 5 hours start to finish. It was her second baby. But I mean, people often talk about big babies. Oh, big baby, right? We hear that all the time. Oh, my baby's so big. And that puts some fear and some anxiety and stress into the woman's mind and body. And, women can deliver big babies if everything is lined up and balanced, right? So it comes right back to spinning babies, chiropractic care, exercise. We see decreased interventions, right? So decreased epidural, decreased Pitocin, decreased C-sections, right? With all of this work, getting the body ready.
And vacuum extraction, that's a big one too, where the baby is vaginally delivered, but
kind of stuck.
Vacuum, and that is so stressful on that newborn's.
And sometimes even a little bit more of an old-fashioned form of that is forceps, right? So some doctors older doctors are actually pretty still skilled at the forceps. And you and I as chiropractors who treat lots of infants, which is a whole other podcast, right? We just are like, like if you can avoid that, that is really, really great. And if you can't avoid it, then some body work after in the form of chiropractic care, craniosacral therapy, et cetera. But I also think just overall a better experience for the laboring mother and the partner, right? With what I call it is no drama. We don't want any drama at the birth, meaning the head is tilted, it's jamming into the bone, the arm is up overhead, baby's not descending.
Baby's sunny side up.
Baby's sunny side up. Baby's not rotating into the proper position. All these different things that come up that, that quote unquote, I know you and I hate this term, failure to progress, episiotomy even, which is done so much less frequently now, but it's still done. So all these interventions that of course are sometimes necessary, but if we can avoid them by just creating a better environment, wouldn't that be great, right? And mother and partner are not, they just have a better experience. They look back at their birth as, wow, that was really hard, but we did it. And my body was able to do it. And it really, I know you and I are completely on board with just having women have the best possible experience they can at their birth.
For sure, because what we see is those empowered births create empowered mothers. And, an empowered mother is really going to make different decisions regarding her parenting choices and how she mothers for the rest of that child's life. So this is very crucial and very, very important.
Yeah.
I wanted to actually spend a few minutes talking about some of the actual exercises in spinning babies. We haven't gone over that yet.
Sure. So there are a number of them. They do talk in Spinning Babies or on Spinning Babies website. I've been to a bunch of their courses. So they talk a lot about the 3 sisters of balance. So those things are, and again, there's lots more, but these are some of the main ones. If someone's going to, again, just have a little bit of time. So that is a forward-leaning inversion, which is really, really one of the core movements in spinning babies. So what that involves is having the woman up on her knees on either a bed or a couch that's sturdy and stable, and or even a step. You can actually do it on a step. You usually have a partner who's spotting you, especially when you're first learning this, and you're basically going into sort of a downward dog, but you're almost a little bit more vertical. So I would recommend people look at the website, the Spinning Babies website, because there's so many visuals of that, and it helps to really see it. And there's videos, there's pictures of it, and you're in that position with your bum in the air and your head down, kind of resting on your arms for about 3 deep breaths, and then you slowly come out of that. And what happens when you do that is that you're releasing some of those ligaments that attach into the uterus. And the interesting thing about it is you're releasing them as you come out of it. So it's just really cool that Gail Tully came up with all of this. It is very easy to do. It is important to have someone with you, especially as you're learning. I do have women who tell me, and I'm sure your patients tell you the same, that once they get it down, they can do it by themselves if no one else is at home with them. One of the other of the three sisters of balance is something called the rebozo. And a rebozo is actually a piece of fabric that you can actually just use a sheet, but it is a specific, I believe was started in Mexico. Don't quote me on that, but I'm pretty sure. Do you know? Yeah. And it's basically a piece of fabric that a woman's on all fours. Her partner is behind her, and basically wraps the fabric around her belly and just very gently shimmies that piece of fabric, kind of wraps the fabric around the partner or helper's wrists, and very gently. They use the term sifting in spinning babies, and I love that term because it's not this violent, intense movement that we would kind of imagine when we hear the description of this, but it's a very gentle sifting, and it really helps to just, again, let everything sort of become more balanced, relax some of the muscles, and it's just a wonderful, wonderful technique, and it's actually quite comfortable for the woman, and it feels really good. And the pregnant mom is leaning against either a birth ball or a chair in front of her, like the seat of the chair. Again, lots of visuals and videos on their website. And then the third is something called a side-lying release. So the side-lying release is where a woman is lying on her side, obviously, and she is her partner is with her and holds her hip. And this one gets a little more complicated. Patients seem to come in and say, "Can you show me that one?" It's a little trickier. And basically, the leg is the woman is lifting up her leg while the partner is pushing on her hip that is up, facing up, and lets the leg hang down on, like, off of the bed or a table, like a massage table. But this can be done at home on a bed is fine. And that leg is hanging down and it's, again, releasing some of those ligaments, and you hold that for a while in that position. And all the details are on the website. So these are really core components of spinning babies. Again, there are lots of other things. There's something called a breech tilt, where you're on basically kind of leaning with your head. Picture an ironing board leaned up against a couch, and mom's head is down toward the floor, and then the feet are up toward the couch. So it sounds really crazy, but if you see it again visually, it makes a lot more sense. And basically, you're trying to release baby out of the pelvis, and again work on those ligaments. And they do recommend holding that for a while, usually about 20 minutes. But some women get back pain, or they get a little dizzy, or they just feel uncomfortable. So I tell them just to shorten the time that they do it. So again, anything we get in is better than zero, and just to do it to your tolerance. So lots of other things on the Spinning Babies website, different positions, but those are some of the core, again, those three sisters of balance, and then add in that breech tilt. That is specifically with a breech baby.
Got it. And then there's also, this can be helpful for VBAC prep as well, right?
Yeah, absolutely. So VBAC, is vaginal birth after a C-section, after cesarean. And many women that come to both of us, right, in our practices have had a bit of a traumatic experience. Not every woman, but many. And they, in the first birth, and they often say, you know what, it ended in a C-section, a lot of times unplanned, right? And they end up saying to us, I really want to go for this VBAC, and I found a provider that's really on board, and I want to do everything I can to help, to get to that end goal of a vaginal birth, which we both know, you and I, that can be very healing for a woman who has gone through a C-section, and that wasn't her desire to have the C-section. So I also just want to say that sometimes C-sections are absolutely necessary, and what we're talking about avoiding are the ones that could have been avoided with some interventions prior, right, during the pregnancy, and to to get the body ready. So I find that doing this work, both our chiropractic / Webster technique work, and then in addition, the spinning babies work, again, it just preps the whole pelvis, gets everything nice and aligned and open and relaxed so that baby can get in that optimal position. So some of the, again, I come back to that word drama and trauma too. It really is drama and trauma that a woman can go through at her labor and a subsequent birth. And I find that if we can decrease that, it just becomes such a better experience. And it really gives that woman the opportunity to have that chance at a vaginal birth, right? So we want to open up that pelvis and make sure baby's in the right position. So a lot of times we'll hear the stories, you and I, right? We'll hear those stories and they'll tell us their birth story from their first child, and they will get into the details of what happened. And it's not that we have a crystal ball and can prevent that from happening again. It's always possible, right? That there could be something at the second birth that happens that requires another C-section or other interventions that the woman wasn't planning on. But if we can do anything to make it a better experience, which this work works wonderfully, both spinning babies and chiropractic care.
Right. And, I think there's one other story I wanted to share that came up recently. A woman was in my practice in her third trimester with her third pregnancy, and the baby was breech, and she had 2 unmedicated vaginal deliveries with her first 2. So was quite committed to having a third vaginal delivery, ideally unmedicated. And she did everything, and this baby did not turn. She was doing spinning baby exercises at midnight before her scheduled C-section. And she had the C-section, and when the doctor was in there, she had done an ECV as well. And the doctor was like, I could see why this baby was not going to turn. And that happens. And these are real stories. And I think the important thing here is, and I communicated this to her, there's no shame. Like it's nothing like she did not do anything wrong. Her body did not fail her. Sometimes these things happen. We can't always explain why. And she has a beautiful baby boy now. And
thank God we have C-sections, right? Thank goodness, because
it was in the best interest for her and the baby. That was definitely the safest option in this case.
Yes. And, we really have to remind ourselves that C-sections are there for a reason. They are life-saving, both mother and baby. These are situations that hundreds of years ago, mother and baby would not have survived, right? So what we're trying to decrease is the number of C-sections that, could have been avoided with interventions prior, meaning all the things we're talking about, right? So I feel like there is definitely absolutely what you're saying is that sometimes there's just circumstances that are completely out of everybody's control, and it is a truly medically necessary C-section. And that is absolutely, absolutely nothing to be ashamed of but there are a lot of feelings around this, and you and I address this often where we,
a lot of grief,
a lot of grief,
a lot of that. And so that's important to acknowledge and process as well, because there was a loss of having, another vaginal delivery. She knew how powerful that was, right? To have an unmedicated birth, and she was mourning that. But, this was a different life experience for her and this baby, and a different journey. Every pregnancy is different. So we just never know. A lot of it's just really surrender, right?
And I do think we need to hold space for that grief and that disappointment and some sadness around a birth that doesn't go the way that we had planned. And I know you and I deal with that. We work with women all the time who have gone through that, and we meet them after the fact, or maybe it's a patient like you were describing. And I think just to really feel the feelings, right? I know we're not trained therapists, you and I, but, just to acknowledge that those feelings, whether it's journaling, whether it's talking to a therapist, talking to, there's groups online that women can talk about their experiences, and just to kind of really own the fact that we don't want to brush it aside. Like, okay, we had a healthy baby, everything's fine. You're not allowed to feel any sadness. You are, and that is completely, completely okay and pretty normal, I think.
Very normal. And I think it is important to feel it and process it.
Yeah.
Yeah. Well, Randi, this has been amazing. Do you have any last thoughts you want to share with our audience?
Yeah, I would just say that I really think it's great if women can get on that Spinning Babies website early in their pregnancies and really start doing some of those daily essentials, look at their lifestyles, look at their exercise, look at their ergonomics, whether they're working from home or in an office, look at how you lift your toddler, getting in and out of bed, really to look at a lot of these things, how you're sitting on the couch and, all of that stuff that we've touched on, and really get into this work early, because some early work with chiropractic care, going for general acupuncture, exercising, stretching, some yoga, spinning babies. I think it really can make such an impact as you progress through your pregnancy, and you really can reap the benefits of all that work throughout. And if you're doing it kind of gently throughout the pregnancy, gently meaning, I mean like time-wise, we're not in that time crunch. I think doing it throughout the pregnancy at a more easier pace usually ends up, you reap the rewards of that, right? At the end,
Right.
where you say, oh, now I'm not in that panic. And it doesn't mean that you can't run into some sort of glitches as you go through your pregnancy, but it just is great to start early and, again, in that, to have the benefits throughout the pregnancy.
That's right. It's just that prevention minded. Let's not wait until there's an emergency to take action.
And they'll also feel much better, right?
Yeah.
Feel really good, but this work makes you feel really good.
You can feel really good during your pregnancy. And I think some women just expect to have normal, quote unquote, pregnancy aches and pains, but you don't have to. You can really, really feel good your entire pregnancy.
Mm-hmm. Absolutely.
Yeah. Well, Randi, thank you so much for coming on. I really enjoyed this conversation. It was wonderful.
Thank you for having me. Wonderful to talk to you.
Well, I hope you learned so much about spinning babies and all the positive things you can do proactively to feel great during your pregnancy physically, as well as encourage baby to be in the optimal position for birth, which is head down or vertex. And I'm once again so grateful to have connected with my friend and colleague, Dr. Jaffe, to speak more on this topic. If you want to learn more about her or to visit her in her Manhattan practice, please visit her website at drrandijaffe.com. And additionally, I'm so excited to announce that I am launching my online program, Brayton Birth Method, and I'm looking for 20 women to participate in the holistic preconception module. So if you're not yet pregnant, but looking to get pregnant and are looking for a like-minded community of women for support, encouragement, empowerment, please check out my social media at Brayton Birth Method on Facebook or Instagram for more information. And I really hope to see you in the group.